Welcome to Toledo Clinic TV. My guest for this segment is Dr. Lisa Graves Austin, and she's an internal medicine specialist. And we're going to spend a few minutes talking about heart disease and women. It's often overlooked. We think of men having heart attacks, but it's a real threat to women. What do we need to be looking out for?
Well, sure. I mean, first of all, heart disease is the #1 killer of women. Period. 1 in 3 deaths worldwide are attributed to heart disease across the board. So it really is a major epidemic, and we're seeing it in younger and younger women. Historically, women develop heart disease on average 10 years before or 10 years after gentlemen because of the protective effects of estrogen. However, you know, there's a lot of women who have hysterectomies, have their ovaries removed, but in general, heart disease is a tremendous epidemic across the board in men and women. It's so important for women to be aware of all their individual risk factors and be aggressive in treating them before heart disease occurs. 50% of people do not survive their first heart attack, which is a very sobering statistic, and women especially are often overlooked. Women, when they present to the emergency room with heart symptoms, often are later to get important blood work to rule out myocardial infarction or heart attack. They're later in getting an EKG. Oftentimes they're dismissed as having anxiety or a psychiatric illness. And sometimes they're sent home with no appropriate workup done. Women, though, don't always present with the same symptoms as men. It's important for ladies to understand this. Oftentimes women will just present with fatigue. They may feel tired, they may be a little nauseous, they may decide to go take a nap, and they miss those important symptoms. Yes, they can have the classic signs and symptoms of chest pain radiating to their jaw, their neck, their arms. Shortness of breath is so important because that is a symptom that women oftentimes will present. You know, guys, a lot of times it'll be the classic pain into the jaw, into the arm, shortness of breath, tightness. But not all guys, but women a lot of times will present with shortness of breath. Diabetics, because of their nerve damage, may not have any chest pain at all. So diabetics for men and women, again, shortness of breath, abdominal pain can be a sign of angina.
And women, I know, oftentimes dismiss their own symptoms.
Absolutely.
Or they're busy taking care of other people. And
they're
so
caretakers.
How do you know when you need to get help?
Right. The main thing are know your warning signs, know your risk factors. Take the time to take care of yourself. And I don't say just women. Men sometimes, you know, men are guilty of ignoring their symptoms too. But unusual tiredness is a warning sign. If it's like out of the ordinary for you, don't just say, oh, I did something, you know, overexerted myself. If there's ever any question, get checked out. Again, 50% of people do not survive their first heart attack. So taking that time is time well spent. It's time well spent.
I'm sorry, what can women be doing to prevent problems? Should they be getting blood work done regularly?
Right. Well, know the risk factors for heart disease. Okay, #1, do you have a family history? It's important to ask your aunts, your uncles, your grandparents. We're seeing more and more premature heart disease in young people. It's really quite scary. Getting your labs done with your primary care doctor, knowing your cholesterol level, knowing your LDL panel, knowing if you have diabetes. I cannot emphasize that enough. Diabetes is a major risk factor for heart disease because the high sugar causes inflammation in all of your blood vessels. So it really escalates your risk. Making sure you don't have high blood pressure, controlling blood pressure, being a healthy weight is important. Being active, exercise your heart muscle. Our heart is a muscle, exercise it. Not smoking, not drinking. Those are also major risk factors. I should say that some of our ladies who, again, I mentioned early menopause, those have had hysterectomies, but also our ladies who have had autoimmune diseases like lupus, rheumatoid arthritis, that also increases their risk for heart disease prematurely as well. So it's important those ladies take it very seriously.
And it's tough to have this conversation sometimes, but crucial that you do that.
Absolutely. There was a study once that 50% of ladies who had a heart attack under the age of 55 did not think they had any risk factors before their heart attack. So that's very, very sobering. So that's why it's important to start early screening and just be aware of the signs and symptoms.
How much of your job is just educating women about those risk
That is
factors?
probably a good portion, a third at least of my job.
Yeah, all right. Very, very important information. Thank you so much, doctor.
Thank you.